Dr. Adrian Lorde. I'm a family physician in private practice, but I've been on the front line during this COVID-19 pandemic. Actually, in recent times, I've been working at one of the polyclinics, volunteering my time in providing services in the vaccination program. The Oxford AstraZeneca vaccine is here. It's given in 2 doses, approximately 10 weeks apart, but between 4 and 12 weeks apart. And it is an effective vaccine. I call it the vaccine for us, in that it is stored at a refrigerator between 2 and 8 degrees, is easily therefore administered, and therefore it is recommended. There are few side effects from it, and it is effective. It is effective. Within 3 weeks of the first dose, you get something like 60% efficacy. And after the second dose, which you must do because it's a booster dose, which is now given in 10 weeks' time, you get up to 90% efficacy. In our elderly population, we have found in all throughout the world that the elderly persons are more susceptible to severe complications of COVID-19 if you get it. So therefore, since the vaccine is here, does not give you 100% protection, but it leads you to protection from severe illnesses and therefore prevent you from having to go to Harrison's Point isolation facility or any other isolation facility or the Queen Elizabeth Hospital. We don't want to lose any more of our elderly population or our aged population or aging population. We want to protect you. Now, in the rollout of the vaccine, you sign up via a WhatsApp number, or you can get someone to email if you don't have access. If you have children or grandchildren or godchildren or brothers or sisters who may be able to assist you in doing so, you sign up as they are being prioritized as the first set of persons. In the 18 to 69 with chronic illnesses is the next set of persons which are now being rolled out. And similarly, there is an address and specific telephone numbers you can go. Please do not go to the clinics until you're called or given an appointment. The rollout is quite simple. You go, you register, you wait your turn, you go in, and the nurse nicely identifies you, tell you what is required, and they stick a little baby needle into your non-dominant arm, and that's it. You're then further monitored thereafter, after registering the document into a SHAPE app, and you're monitored for 15 minutes. Questions asked: who should get the vaccine? Almost anybody and everybody can get the vaccine. If you have any of the chronic non-communicable diseases, and most of us have one or more of these chronic non-communicable diseases, the high blood pressure, diabetes, heart disease, stroke, heart attack. If you have any autoimmune diseases like lupus or any of the such illnesses, rheumatoid arthritis, if you have arthritis, if you have asthma, if you have sinuses, if you have cancer or had cancer, HIV disease, you can take this vaccine. There was a lot of talk about allergies. If you have drug allergies or food allergies like penicillin or sulfur or shrimp allergy, you can take this vaccine. They just monitor you a lot closer. And if you have to use an EpiPen, this is a pen to prevent you from getting severe anaphylaxis, which is a severe allergic reaction. Then walk with this EpiPen, not to prevent you, but to use in case you get one of these severe reactions. You're monitored for 15 to 30 minutes, and then that's it. Now, what are some of the side effects that people might get in this, having had the vaccine? Most common side effects are side effects that you get from any vaccine, and these could be a fever, 60% of cases or less, headache, nausea. Some people get dry mouth. Some people get muscle aches, joint pains. But these last for 24 to 48 hours. Fatigue is another symptom that one may have. Itching at the site and redness of the site of the injection. That is normal, and that takes about 48 hours or sometimes even more before it goes. In case you get any of the fevers or fatigue or muscle aches or headaches, take 2 paracetamol every 4 to 6 hours on an empty stomach, and that alone will get rid of your symptoms. Drink lots of liquids, but continue to take your regular medication as prescribed. Even your aspirin that you may be on or any blood thinners that you're on, continue to take your medication as prescribed. We don't want you to take your Advil or other anti-inflammatory medications for the fevers because, dengue is around and we don't want you to take that because you never know if you're treating the dengue or if you're treating the remember to keep that card that you're given safely and go back on the said date, whether it be 5 weeks, whether it be 10 weeks, to the same location that you had it, so that you will be